Hello ladies and gentlemen, Kevin Lucas here, and I'm very excited to be talking to you today about what I've been spending the last 15 years of my life being obsessed with, which is helping people find relief from pain, more specifically helping them learn about their body and how to find the most amazing functional posture that you can possibly have and actually sustain and put into play. What we're going to talk today about is the myths and the truths about posture. The reality is that almost all people who have learned about posture and almost all people who are teaching posture are actually teaching it in a way that's not sustainable, and it's not easy, and it's not something that people are going to consistently do, which is why it's such a big deal. And why do I say that? This is the number one reason, is that when people think about having good posture, almost always it's a negative thought. It's a negative idea that comes to their mind. They think about mom or dad or grandma or grandpa with a finger in their back, poking them, telling them to lift that rib cage up or to suck that tummy in, or they're thinking about that drill instructor, yelling at that recruit to have better posture. They're thinking about their dance teacher. The list goes on and on and on and on, and almost always when we start talking about posture, people, you can just see the look on their face like, oh no, I just don't want to go there. So the reason that I say that it's not sustainable is because the way that it's being taught is something that people just aren't putting into play because it's a forced mechanism. The truth is, as human beings, when we're forced to do something, the likelihood of being able to sustain that and make that a part of our daily habit in a way that's positive is very, very, very small. So what we're going to do today is we're going to break down all the barriers, and I'm going to show you how easy posture is supposed to be. I'm going to share my greatest nuggets with you, and we're going to get rid of the mysticism and the mythological unicorn that posture supposedly is. So, what is the first thing that we need to get rid of when we're talking about posture? The number one thing that we have to understand is that posture is something that anybody can have and should have. In my clinic with structural innovations, we specialize in working with the worst of the worst. People that should have died from their trauma or their accident, people that almost died or did die from their disease and came back with medical intervention, people who are extremely tall, people who are extremely short, people who are young, people who are old. We've really worked with people who are in the greatest amount of pain and are dealing with the most deficient, ineffective structures that you can possibly imagine. Tall, short, skinny, heavy, doesn't matter. We're able to help people find good posture and do it in a way that's sustainable, that is going to help them decrease pain, and most importantly, have a functional, happy, vibrant, dynamic structure no matter where they're coming from. So let's get rid of that first piece that we were talking about. Here's how most people teach posture. Number one, they say you must suck in your core and have a tight core, and by sucking in your core and holding in your core, having a strong abdomen is going to be the first piece that's going to give you good posture. Well, that's not a truth. Now, could the majority of our culture benefit from being in a little bit better shape? Yes, that is possible. But this ideology that good posture is going to come from sucking in those abs and tightening up those abs, that's just not true. And we're going to explain a little bit more in detail why that's going to come into play. The next thing is that famous bring the shoulders back. Again, something that's not sustainable because you're forcing your body into a position that it just can't compete against, and we'll talk about more in detail what that is as well. And the last most important piece is what's going on with the head, and there's a hidden nugget, there's a hidden bit of information that nobody ever talks about. I have had people from all over the world come to me for care with the therapy that we specialize in, which is the Rolf method of structural integration, and then my relief through rolling program, which is being able to use the foam roller in a pain-free, effective way that's actually going to help you decrease your aches and pains and help you find relief from pain by improving your posture in a systematic way that's very simple and fun to do. So, the last piece that nobody talks about is what's going on with the legs. And this is a very crucial thing that, again, I've never had one patient or one student come from any other area of study or expertise and put that into the equation. And we're going to kind of talk about how to do that. Okay, we can't deny the effects of someone who has good posture on anybody. We can be at that party, we can be at an event, and all of a sudden that person walks in the room, that person with glowing, great emanating posture. They seem to have this energy about them, they have this confidence. All of the people in the room stop what they're doing and they look at that person who has quote unquote good posture. The opposite side of that token is also true. That person that walks into the room that's just all, curled over and depressed, and there's a lot of things that we assume about people who have good posture or people that have poor posture. Now there's that whole middle ground of in between where people maybe aren't severely deviated in regards to their body, but boy, that person, that man or woman that has that amazing posture that's exuding confidence and is exuding energy, they captivate us, they draw us in, they gather our attention. Think about in books and pictures. We can even go back to the Egyptian time periods where if we look at the ancient characters and the deities that are carved in stone, do they have this very nice elongated posture, or are they all slumped and rounded over? Whether we're talking about kings and queens, politicians, we talk about movie star posture or dancer posture, this idea of really great posture over and over really comes into play, and there's so many reasons on why it's so important. When your body has quote-unquote good posture, you're going to be more efficient, your muscles and your fascial tissue is not going to be working so hard, you're going to have better circulation because your pieces and parts of your body aren't rotated or tilted out of where they're supposed to go. And this is going to bring us to the number one thing that we're going to talk about in teaching you so you can understand how posture really needs to work within your structure. So when your brain understands what's going on structurally, then it's going to make it much easier for you to really move forward with being able to facilitate good posture. And we're going to use some very, very simple toys to talk about these concepts. We're going to have our Legos here. We treat a lot of children in our clinic, so we got a big old bucket of Legos. Now, our body is built in segments of blocks. Now, the amazing thing about current medicine or Western medicine or mainstream medicine is that it's really amazing in life and death situations, meaning if I'm in a horrible car accident, my arm gets cut off, I'm so grateful that the surgeons have such a detailed understanding of the body that they can reattach my arm. But when it comes to dealing with chronic pain or long-term pain, quite frankly, what a lot of our patients and many of my graduates' patients are reporting is that mainstream medicine is really not meeting their need of being able to find relief from chronic pain and moving forward and improving. And there's one simple thing going on when we're dealing with a lot of very chronic structural pain is that people don't understand how the whole body is connected. And I'm going to show you how this comes into play. So if we take our blocks and our body and we're looking at our skeleton here, we understand that we have feet, we have lower legs, we have an upper leg, we have a pelvis, we have a spine that runs from the pelvis all the way up that the head sits on top of. Our rib cage is part of the spine. So we can see, that whole knee bones connected to the hip bone song that we all learned when we were young is absolutely true. And we need to come back to that ideology if we want to make long-term change with our structure instead of having to pay doctors and spend tons of money and tons of time treating the same problem over and over and over. So we're going to come to our Legos. If we take these Legos and we unstack them and we twist these blocks and we put them in different positions, what do you think is going to happen with this structure over time? Yep, you're exactly right. Even our 2-year-old children who are playing with these blocks know that they need to be stacked in a certain way so the building or the blocks don't fall over. And what happens with our body through overuse, underuse, injury is that our fascial system, which is what determines the position of all of your muscles because it covers and it surrounds all of the muscles, your fascial system, which is what determines the position of your organs, it surrounds every piece and part in your body, muscles, bones, ligaments, tendons, nerves, veins, arteries. Fascial tissue is what we call the organ of structure, and it's what really determines the position of all your pieces and parts. When we're overused, underused, or injured, that fascial system starts to shrink and it pulls our body out of position. When that happens, or if I'm working a repetitive job where I'm using my body in a certain way over and over and over, that also tends to shift my pieces and parts away from how they're structurally supposed to be moving. Now, yes, our bodies are designed for dynamic movement. We're supposed to be able to do all of these amazing functions and use our body in a myriad of different ways. But our bodies are not designed to do the same repetitive motions 60, 80, 100 hours a week for 40 years at a time. That's not how our body's designed. So back to our Legos here. So we got our structure. We can see all the blocks and the pieces and parts are rotated off of each other. Now watch what happens when I put just a little bit of pressure on the top of this structure. See how it falls apart? The whole thing, no matter what way I push on it, there's no stability here because nothing's supporting the block below it, and all of these blocks are shifted off of each other in a way at which gravity can't, or a way in which gravity is affecting the structure in a more negative way. So it doesn't matter what block I touch, with very little pressure, the whole thing is falling apart. Now here's what we need to understand when we're talking about posture, is that our body is designed to be stacked in a certain way in the field of gravity. And this is one of the key things that nobody's talking about. If you go to your doctor and you're having all sorts of neck pain, shoulder pain, back pain, whether it's a chiropractor, your orthopedic doctor, your general practitioner, massage therapist, Pilates, yogis, your personal trainers, they're talking about posture, but they're not taking into consideration how your body is stacked in the field of gravity and how to get it there in an efficient way that's sustainable. So now what happens if we take these blocks and we stack them on top of each other the way that they're supposed to be? The next thing you know, this structure is what we call balanced in the field of gravity. And why do I say that this structure is now balanced? Well, what's going on is that the center of mass of one block is stacked on top of the center of mass of the next block. What we were demonstrating before, when the blocks were rotated off of each other, now there's a whole lot of surface area that gravity is affecting the structure, and there's nothing there to support it, so it's very easy for this to fall over if I put pressure there. So if we go back and we put the pressure, or the blocks back to here, and it doesn't matter where I push and how hard I push on this structure, even if I kind of rock it around, it's going to stay solid. And this is one of the key fundamentals that we need to understand, is that if your whole structure is not stacked on top of each other like it's supposed to, there's no way you're going to be able to move yourself away from consistent and chronic pain. There's no way you're going to be able to move yourself away from having all of these nagging aches and pains that can come and go. It doesn't have to be chronic. Maybe you're a weekend warrior and you work, at your desk during the week, and then you play a ton of sports on the weekend, and you're constantly struggling with all of these injuries that never really get better. A lot of that is going to have to do with the alignment of your whole body, and not just one piece and part, not just the shoulder that you're feeling, not just that neck. And it's not about sucking your tummy in, bringing those shoulders back, and bringing the chin in. Again, that's not sustainable. So we have to take, number one, the whole structure into consideration and how it's related to gravity. All right, ladies and gentlemen, we're going to talk about the next key concept. So we're going to put our Legos aside, and we're going to come to another very basic tool that's going to give us an idea of what's going on in the body. So we were talking about gravity and how gravity works. We're going to explain that to you a little bit more. Now, we understand that. How do we know if something is more balanced or less balanced? Well, we use the field of gravity, and gravity runs at a straight vertical line from our bodies. It comes through the top of our head, through the ground, through our feet, and our body contacts the earth. Actually, our body and the earth are attracted to each other at the same force, but because my mass, or the weight of my body, is much smaller than that of the earth, I can't go anywhere. I can't jump away and fly forever like I could at the moon. And the reason that is that the moon is much smaller. So the astronauts, you can see them, the videos on the moon where they're jumping much further. The weightlessness in space, all of that, those have very scientific pieces and parts to what's going on. So most of us can have a picture in a house that can be crooked just a little bit. And how long would it take before you want to go over and fix that picture so it's perfectly straight up and down at the edges, the top edges, the side edges? This is how gravity works in our body as well. There's a certain way in which our body needs to be stacked, like I was saying, for everything to work like it's supposed to. Now, if I take this exercise band here and I just hold on it, or I just hold the top of it and hang it, we can see that it just hangs. It drops towards the ground and it hangs very evenly. It doesn't hang over to the side like this. If I let go, it swings back to the middle where gravity is pulling it straight down to the earth. Now, we talked about fascial tissue so far, and we're not going to go into a great detail about what it is. There's a lot of great resources you can research to really understand fascia at a higher level. What you need to know about fascial tissue, though, is that it's what determines the position of your whole entire structure. And what most people think about their bodies and how a lot of anatomy is taught, in fact, is that people think that we're made out of pieces and parts and that we're Legos, like the blocks down there. And if I take out the bad one and I put in the good one, then my body's going to be 100% back to what it was before the injury or before the ache and pain that I had. And that's not how the body works. In fact, the body and the muscle system and the fascial tissue are long sheets of tissue, meaning that if we look at the development of our bodies embryologically, that we're not one muscle that goes to the next muscle that goes to the next muscle. We're built in layers, much like an onion. And if I take that outer layer of the onion, or if I have an orange and I peel the orange, that whole peel can come off together because that's one layer, that's one part. When we're talking about our structures, it's very similar. If I take this sheet and I put it on the skeleton here, we would actually, even though that we name muscles, different muscles in different areas, in a certain plane or in a certain layer, it's all the same tissue. Now here's what happens. So many people will come into our clinic and say, oh, my pain is all right here. I just hurt here. And I've been getting really great adjustments. I've been getting good massage therapy. I've gotten Botox injections. I've gotten cortisone injections. I've been taking painkillers. And I still have all this pain here. Well, again, a big part of the problem is that most healthcare providers are not looking at this whole structure. Now, let's say this neck pain and shoulder pain that a person is having is true. They're experiencing that pain. We can see that there's arthritis. We can even see that there might be deterioration of the vertebrae or the discs itself. Now, a chiropractor or an orthopedic doctor can look at the structure and will say that that shoulder is lower on the left than it is on the right. Well, why is that? A lot of times people, when they go get really good therapy, they'll see that and they'll say, oh, well, the person's right side is weak, so what we need to do is we need to strengthen that right side to balance them back out. So they get a lot of really great therapy. They're getting a lot of good strength and conditioning coaching. They're getting a lot of good electrostim and all of these different things to try to balance the structure out. Well, what were to happen if I just let go of that sheet so it's not pulling so hard? Can we see how all of a sudden those shoulders have leveled out? That's exactly what happens in the body. This relationship of tight cables that run along a whole entire line is absolutely true. And this plays true left to right side. This plays true front to back. It even plays true in what we call a zigzag patterning. And by that I mean I can have a left low back that's tight, that's maybe pulling my trunk over here, but the body's goal, the body has to have the head sitting level. So it's not going to just fix the head. It's going to, the next block above it has to try to balance itself out. So now if my left low back is tight, then my shoulders have to try to fix that. And then if I'm still we know that the body often always overcompensates. So left low back is tight, then that draws the left shoulder down, then my upper neck is going to try to contract and bring that head back to level, and now my head is a little bit too far the other way. This zigzag patterning is a big part of the problem. So if I'm in this position and I'm having terrible neck pain on my right side and I'm getting adjustments and I'm getting massage and I'm getting injections and I'm seeing all of these different healthcare providers, but I'm still having the same problem, we have to think about it in a different way. And what happens if I can get this left low back and trunk to open up? All of a sudden the body has an opportunity to change. This same relationship can happen in the legs and the hip. Let's say we take our band, we put it over the hip, and let's say I pull down on this hip and it shifts this whole entire structure. Well, the person might be experiencing the pain in the neck, but the problem is actually coming from another region in the body. And if we don't look at the body in this capacity, this is why people are spending millions and billions of dollars seeing great healthcare providers, but they're not really getting much benefit, and they're having the same problem over and over and over. I ask my patients this all the time. When they come to me and they talk to me about their back pain, I don't ask them so many questions about, well, what's going on exactly with your back pain? I ask them, why does your back pain keep coming back? If you're getting great physical therapy, you're going 2 or 3 times a week, you're getting chiropractic adjustments, you're getting massage therapy, you've been to the orthopedic doctors, they've done all they can do, you've gotten injections, they've done cortisone or Botox, you've had surgery, and you're still having the same problem, but you just keep doing the same things over and over and over. And what's really fascinating as human beings is that we wouldn't put up with that when it came to our cars or our house. If I had a contractor come to my house, or if I had a leak in my house and a plumber came and fixed it, but 2 days later I had the same leak in my house, what would I be doing? You're exactly right. I would be on the phone to that plumber saying, hey, you need to get back here and fix this, and if you don't fix it right this time, I'm gonna go to somebody else who's gonna do the job right. When it comes to our own bodies, oftentimes we don't put that into play. We ignore that and we just keep seeking the next thing and the next thing and the next thing, not taking all of these relationships of the whole structure into consideration. And with Relief Through Rolling, our foam rolling DVD, this is what we take into consideration from the very, very beginning. We have to look at your whole structure and understand where the cables are going and how to put the cables back in the right spot and how to free up that fascial system so your body can function at its best, so the aches and pains can start to decrease, so you can take care of yourself. And in the world of structural integration, it's the same way. We're looking at your whole structure, we're looking left to right, front to back, top to bottom, because the reality is everything is 100% connected. And until we understand these concepts, we're never going to be able to have, quote unquote, those good posture pieces. So what we're going to talk about next is how neck pain, back pain, hip pain, knee pain, some of the most common pains that we see across the globe happen, and in my opinion, why they keep coming back and a lot of people aren't getting relief from those pains. All right, ladies and gentlemen, what we're going to do next is we're going to talk about the key fundamentals on how to establish, be able to sustain and maintain good posture in a very easy, effortless way, so you'll actually be able to do it so you can experience the benefits of having great posture: increased circulation, better flexibility, decreased pain, increased range of motion, increased energy because your body's not working so hard. So the first thing that we're going to be talking about is that we have to understand that the whole body is connected. And I know we keep talking about this over and over and over, but this is really the biggest key. Again, if all we're doing is sucking our stomach in and we're bringing our shoulders back and bringing that chin in, that's something that's not sustainable. So there's 3 regions of the body that we really need to look at in understanding how to facilitate good posture. And the number one place that we're going to start with, that virtually nobody else talks about, is what's going on with the legs. And the legs are the foundation, and if the foundation isn't straight, nothing else above it will be able to be in the right spot. Now, how is it that we understand this when it comes to our homes, building a house, our car? If the wheels aren't aligned right, so the car can't drive straight, we know that everything else will deteriorate at a much faster rate. And the same thing that happens in the body. If my legs aren't in the right spot to support my structure, everything ends up falling forward, then my back has to engage to bring me back to where I'm supposed to go. Then I'm playing this giant tug-of-war that's actually tightening down my whole entire system. And now it's like I'm wearing a spandex suit of saran wrap that's sticky, and it's like spandex and it's shrinking, and I'm having to try to move while I'm wearing that spandex suit of saran wrap that's about 10 sizes too small. As you teach your body how it's supposed to move in the more efficient ways, the way that the body is designed to move, those spandex suit of fascial tissue and saran wrap starts to relax, it starts to melt away, and your body can actually move like it's supposed to be moving. So here we go. We're going to talk about and really show you the importance of the legs. So if we come back to our skeleton right here, And again, we can spend a day on each of these topics, 6-8 hours a day, really breaking down the nuts and bolts, but we're gonna do it for you in each segment in about 5 minutes so you can really understand, so your brain can see what's going on, so you have an understanding, so you can see why just sucking in that stomach isn't gonna help you sustain good posture. So if we look at our skeleton here, if the legs are wide, or if I end up turning a leg out, that makes it so that foundation that I'm supposed to be standing on isn't in the right spot. If we drop our plumb bob line down from gravity from the hip, we can see that what it does is that it actually drops at a straight line out of the hip, right, like this. Now if I bring my leg out wide and I stand with a wide stance, or if I stand with that shoulder width stance that a lot of people talk about, if we come out to the shoulders, we can still see that this line and the width of that knee and the foot, there's nothing there to support it. Remember, gravity is coming out of your body at a straight vertical line down out of the pelvis. So if we take our pelvis and our legs are coming out at a wide stance, gravity is now moving out of this straight down, and we can see there's nothing there to support it. So until we get those legs underneath where they're supposed to go, we're never going to be able to have our body functioning nearly as well as what it should be. So if we can get those legs right underneath the structure where they're supposed to be, now the structure has the ability to be here and be supported the right way, which is going to allow the pelvis to sit more level. So the legs are a huge key that nobody talks about. And here's the biggest problem with the legs. If you understand and if you work in the healthcare industry, the #1 complaint when we come to which part of your legs hurt, everybody complains about the back of the legs. They complain about the hamstrings. I don't want to say they complain, they report. They say, this is what I'm experiencing, they're tight. Here's the next thing that they say is that I stretch them all the time. How many of you yourselves or know people who are always stretching their hamstrings, but they always have hamstring tightness and hamstring pain? This is a major, major problem. And the reason is because you're dealing with the symptom and you're not dealing with the problem. If we turn our skeleton, our little model here around to the side, what happens is that we have to look at the relationship of the front side of the body to the back side of the body. Because most people sit all day long, right, like this. This shortens the quads in the front and it elongates the hamstring in the back. And then when I end up with an anterior tilt in my pelvis, which I'm going to show you here in a minute, that shortens the quads in the front and it lengthens out the hamstrings in the back. Then we throw in the fact that if people that are going to great massage therapists, they're seeing orthopedic doctors, they're seeing personal trainers, they're seeing Pilates practitioners, yoga practitioners, they're seeing all of these people that are telling them, well, we need to stretch your hamstrings even more. So very easy to understand this. If my pelvis is supposed to sit level, right, like this, and then my legs come out right here, and the hamstrings come down, and the quads come down. If they're even, my pelvis is going to be able to be level, my spine can sit on top of this, and then I'm going to have a great functional body that isn't going to be as painful. We're not going to have all the decrease in range of motion. We're not going to have the tightness. Now here's what happens to almost all people, especially in our culture. If you go to other cultures where they use their body differently, they do a lot of squatting, we can see some differences. But in America, on average, if you took 100 people off the street, you're going to see 98% of people on average have these exact conditions. So now let's say the quads get tight in the front. I'm going to tilt that pelvis forward. The legs are going to come out, the quads are going to be short, the hamstrings are going to be long because they're coming from way up here. Now my spine is really crooked and everything's forward, and it's very difficult for me to be able to sustain that line. So again, we want to approach the body that if you get the short cables to lengthen to their original length, the cables that are too long and that are expressing the pain, that are saying, I'm too tight, which is true, they're tight because they're too long, they're going to come back to their ideal length, and now we're going to have cables on the front and cables on the back that are contracting at a more even rate. So this is a big part of the problem. In order to get these legs underneath the body and getting them so they're pointed more straight forward forward like railroad tracks, which is how the legs are designed to function, we have to get the relationship between the quads and the hamstrings more equal. And that is going to mean you're going to have to spend more time stretching your quads, and you're going to need to give your hamstrings a break. Stop stretching them 4, 5, 6 times a day. And again, back to the definition of an insanity, if you're doing the same thing over and over and over, expecting a different result, you're not going to have a different result. You're going to have the same thing, which is a deficient, deteriorating structure, and it's going to be impossible for you to have good posture if we can't get the legs where they're supposed to go. So that's going to be what's going on in the legs, and I hope that makes sense. Really simple. It's a matter of appropriate tone, left to right, front to back, and when we can have that, we no longer have to force good posture. All right, ladies and gentlemen, now that we've talked about the legs and what needs to happen for the legs to be in the right spot, that's going to support the pelvis so the pelvis can be more level. We're going to come to the next most common myth when it comes to posture, which is what people are doing with their abdomen. Now, this is going to probably frustrate and irritate a lot of people, and in fact there's a lot of people who are going to disagree with everything that I'm saying right now. But the difference between what I'm asking people to do in regards to finding better posture and sustaining their line and having good postures, we're trying to get you to do that by allowing your body to do that. Because again, if we're forcing our body into a position, we're forcing our body to play tug-of-war against gravity, which is what almost all people are doing when they're using the most common way of being taught posture, they're never going to be able to sustain posture and have a really good line and move as well as what they're supposed to be moving. And when your posture, really what's going on is that when you have good posture and you're doing it in a relaxed manner, you're allowing your body to be in that position, and you have the cables more equal in tone and you're not playing tug-of-war, it creates an element of efficiency, and you're going to feel like you're floating. You're going to have more energy at the end of the day, the end of the week, the end of the month. Your body is actually going to last longer by the time you get to your 60s, 70s, and 80s. And this is something that we see it all the time in our clinic. The thousands of patients that I've treated and we've taught these concepts to, the professional level athletes, the people who should have died from their disease or trauma, it doesn't matter the body. We get them to start participating and understanding these concepts. The next thing you know, they're able to sustain good posture, and they have so much improvement from that point. So the next biggest amount of mysticism that happens and the myth in regards to posture is sucking in that stomach. I cannot express enough how much I believe, my opinion, that this is absolutely wrong. And we're going to look at it from a physiological component of how cables work. So your muscles contract and they relax. The fascial tissue, which is what encompasses those muscles, keeps them in the positions that they're supposed to be. It also allows the muscles to slide like they're supposed to be. And when a muscle is relaxed, that fascial system actually allows that body to have support and structure in it without the muscle firing more than what it needs to. And quite frankly, what we find with almost all of our clients, all of my students find in all of their clients, is that people are working too hard and they're contracting more than what they should. A very good example would be is if you had all of the lights on in your house, but you're only in the kitchen. You don't need the bedroom lights on, you don't need the hallway lights on, you don't need all of the lights on, and you're using an incredible amount of energy, and I only need the lights on, and I only need the lights on the right amount for whatever project it is that I'm doing. If I'm just relaxing and being mellow in the kitchen, maybe they're a little bit lower. If I'm working on a project and I'm cooking, I want them a little bit brighter so I can see what I'm doing. But I don't need every other light on in the house. And when it comes to posture and our structure, that's exactly what's going on. When your body's not stacked right, when a certain area of your body is contracting more than what it should, now all of the other muscles and fascial tissue in your body has to contract at a higher rate to keep you from falling over. So when it comes to the abdomen, we have to get you to relax your abdomen. This is the number one source of contention that I run into, especially if I'm working with yogis, Pilates, and personal trainers, because they're taught that you're actually supposed to hold in this core and you're supposed to have a strong, tight core in order for you to have good posture. And I can't tell you, especially when it comes to the rectus abdominis, how false that is. So I'm going to tell you what the action of the rectus abdominis is. So in the world of anatomy, every muscle has a particular action that is its primary primary motion that it does. The action of this muscle on the front, the rectus abdominis, is flexion of the trunk. It goes from the rib cage here, and it inserts onto the pelvis here. So now think about that. If this muscle shortens, what's going to happen to your structure? Go ahead and you can stand up, you can tighten those abs, and you can feel that that's pulling you forward. So how is it possible that you're going to be able to have nice, elongated, relaxed posture if I'm contracting all of this tissue in the front? You're right, you're not going to be able to. So the number one thing that I tell my clients is that we have to get you to stop sucking in that stomach and holding that stomach, because when you combine this holding and pulling you forward and then gravity pulling you forward, you're never going to be able to have good posture. It goes back to that the idea that if I'm supposed to have something that's level and I make it crooked, so the rectus abdominis is in the front, it's going to spill everything forward. So there's no way my upper back and neck can be in their correct positions. They're always going to be like this because this is always pulling forward. Now, people say, I've even had a lot of other healthcare providers tell their patients that the rectus abdominis should lift the pelvis up. Again, it cannot compete against gravity. You cannot take this muscle, make it strong enough that it's going to level out your pelvis so your pelvis is going to be level. After enough time, it's going to just end up pulling you forward, and there's our deterioration process. So the next biggest step that we have to do to get you to be in a more efficient state is you have to let this abdomen relax. Once we can do that, that's going to change so much of what's happening in this neck. Again, watch what happens when I pull this down. You can see how that has a tremendous impact on my shoulders, my neck. You can even hear it in the pitch of my voice. It changes when it squishes forward, versus if I'm here, the pitch is going to be a little deeper because now my rib cage is more open. So once we can get you to relax that belly, now that doesn't mean that some people aren't as fit as what they should be and we need to establish decent tone, but the ideology that we need to be constantly holding this in to have good posture, that is, in my opinion, absolutely not true. And if we want to move you forward into a highly functional structure, we need to get you to get this to soften. All right, ladies and gentlemen, we're going to come to the last piece, which is untying and unraveling that mystery of having quote-unquote good posture. So number one, it's suck the stomach in. Number two, it's bring those shoulders back. And then number three is bringing that chin in and back. So what we have to do, we've talked about the abs. Now we need to go to the next section above the abs. And what a lot of people do with really good intention is trying to help their patients, their clients, their students, whoever we're seeing, establish better posture and help correct a lot of their neck and back pain, is that they teach their clients that they're supposed to engage those shoulders, or they need to strengthen their back. They need to bring those shoulders back. Again, we're going to come to a very similar idea that we talked about with our quads and our hamstrings. Now what happens is that our pectoralis major muscle in the front, in combination with the rectus abdominis, this whole sheet of tissue, because remember, everything is long sheets of tissue, this gets tight and it pulls everything around to the front, because everything we do is in front of us. Whether I'm driving, whether I'm working at a computer, whether I'm sitting on a couch, clicking the clicker, so much of what we do is here. So there's a propensity in the structure for it to round forward and get stuck in this position. So we're going to show you another very simple drawing, another very simple analogy. If I have a straight stick, and if I have cables that attach to either side of this, and I put a bow in that stick, one set of muscles have to get really short, and then the other muscles on the other side, yep, you guessed it, they have to get really, really long. And again, almost always, where do people experience their pain? They almost always experience the pain in the area that's too elongated, it's too stretched out, it's too deviated. So what we have to do to get this stick back to being nice and straight is that we have to get this muscle tissue or this cable on the front side to relax so that can come back into its natural position. What happens is that if I try to force the musculature on the back side to compete against the musculature on the front side, it's not going to be successful. And why? The number one reason is because you cannot compete against gravity. It's too consistent, it's too strong, it's too present. On top of that, the muscles that bring the shoulders back to the more of the midline, so they're not so rounded, those are called the rhomboids. And those muscles, if we compare them to the size of the pectoralis major, they're probably 4 or 5 times smaller in their mass. They're very thin, they're not really long, and if we compare that to a big giant pectoralis major in the front, there's no way it can compete with it. So if you compare the size of the musculature that's bringing the shoulders medial or bringing it back to where it's supposed to sit, and gravity, there's no way that just strengthening your back and your shoulders is going to help you fix your quote-unquote bad posture. So what do we need to do? We need to start doing some very basic techniques with the Relief Through Rolling program to help get that stretch in the front, or basic chest stretches, standing in a doorway, laying on the edge of the bed to get this to open up. Once this starts opening, now my body is going to be able to, on its own, more efficiently, be here instead of being so pinned down. So that front to back relationship, again, if I'm squished to the left side over here and we just say, well, you just have to strengthen your right side. So now I'm strengthening, and now my body's too contracted because both sides are over contracted or hypertonic, and I'm not going to be able to have the nice long line that I'm supposed to. So if we can get this side to open and then get the body back to being more straight, left and right, front and back, horizontal and vertical, then I can accurately figure out what areas I really need to tone and strengthen and which areas I don't. But until we get to that point, we're never going to really be able to address the structure, big picture, long term, and you're going to have to go to that chiropractor because you have to. You're going to have to go to that massage therapist because you have to. You're going to have to go to that doctor because you have to, because your body is deteriorating and you're not really finding where it's supposed to be and allowing it to function in a efficient, pain-free, vibrant, dynamic way. So now that we understand that relationship to the shoulder girdle and the neck, what I really want you to see is that your neck pain and your neck symptoms might have a very significant increase in their ability to get better if we change everything below the neck. But what happens is that everybody, again, is they're leaning forward, their arms are crossed, we sit on our arms on the desk, all these different things. So until we get the legs under the body, the pelvis then can be more level. Now my spine can sit on my top of my pelvis if I let my rectus abdominis be more soft instead of holding that in all the time. Again, you know, we're at the pool, we always think about, man, we've got to suck that in and make it look better than maybe what we think it does. And then when we come to that chest, it's the same thing. Watch what happens to my neck and my shoulders if I round that forward. So if I just bring my shoulders back, that's not really fixing anything. And if I just bring my shoulders back and exaggerate this position of what quote unquote is good posture, it's not sustainable, because after 30 seconds, maybe I make it to 4 or 5 minutes, I'm gonna have to let go out of that, and then I'm just gonna continue to fall the other way. So a lot of people's neck pain happens because we have our head that's supposed to sit right on top of the structure here. Now, when this pulls down in the front, the mechanism for the head is that the head can't look at the ground here, so now the head has to come up. So if I'm too rounded in the front, that would put me in this position. So the compensation is for the head to shift here. So now I'm compressed here, and then I'm really compressed in the back side of the body, and I'm compressing on that tissue so tight and so hard that it actually can start to herniate and rupture discs. It can start to deteriorate the vertebrae. The list goes on and on and on. We can have thoracic outlet syndrome, which can mimic carpal tunnel symptoms. The amount of time and money and misdiagnoses that happen as a result of treating the symptoms, which is the deterioration, the arthritis, and the problem is actually everything below this is not where it's supposed to be, is tremendous. So when we look at the body in these dynamics, understanding that 1, everything is connected. 2, we have to work within the field of gravity, because you can either work with it or you're going to work against it. And 3, we have to understand that it's a tug-of-war of your fascial system. Cables left and right have to be equal in tone. Cables in front and back have to be equal in tone. When we can meet those 3 criteria, Our body will be more efficient in gravity. We can have good posture that's sustainable, that I'm not forcing, which is not sustainable, and we're gonna see a more vibrant, dynamic, happy life. You're gonna see aches and pains and diagnoses go away that you've not seen with any other healthcare provider or with other concepts and ideas, because you're forcing the body to do something, one, that it's either not ready to do, or structurally it's physically impossible for it to be positioned correctly because we're not looking at the whole structure. So I hope that makes sense. I try to make it very simple, very easy to understand. If you apply these concepts into your life, I know you're gonna have big changes. And so what we're gonna do now is I'm gonna just show you real simply how we teach people how to find what we call their line or establish good posture. All right, ladies and gentlemen, here we go. We're gonna actually give you the most simple, basic way to find posture that we found to be the most sustainable, the easiest, and the most efficient. This, our patients report over and over and over, is 1,000 times easier than just about every other way of finding good posture out there. And it's sustainable. Now here's the thing, if you've been using your body in a certain way, it's gonna take a little bit of practice and it's gonna take a little bit of time to get it to a point where this is gonna be more normal. But after a few weeks of doing this and thinking about it throughout your day, it's gonna become second nature, and this is gonna be your new way of being. Now, if you're a normal guy, you've been used to standing, with the really wide, all of these different things, just keep in mind it's gonna take a little bit of practice, just like learning any new movement, new sport, new activity, whether it's bungee jumping, rollerblading, bicycle riding, or cross stitching. It's going to take some time to just learn the basic techniques, and once you get it, and that learning curve as you kind of ran through it, you're going to have it down, and it's going to change your life. So there's going to be 3 steps that we're going to use. It's going to be so ridiculously simple, you might not even really think that it's that effective, but the thousands of patients that I've worked on over the last 15 years, the thousands of patients that my students have worked on over the last 15 years, all say the same thing, is that this is the most effective, easy, sustainable way of being able to establish and sustain good posture, so they can have a decrease in their aches and pains, so they can have an increase in their functionality. They're gonna be living a more vibrant, dynamic, happy life. So step number 1, remember, we talked about earlier, we have to get the legs underneath the body. If the legs are too wide, even if my legs are shoulder width, that a lot of people teach people about good posture, is what happens is that gravity comes out of my body at a straight vertical line. Once it gets to my pelvis, it comes down at a straight line out of the center of my hip. And what happens is that we can see my leg is not underneath me to support that. So how do we find the right spot? We're gonna ask you and encourage you to go about your fist width of space. So your body, your fist, on average, about a fist width of space between the base of your big toes. Not your heels, but at the base of the big toe, right here. That's gonna be the line that we're gonna be looking for. When your body can go to that spot, now I come out of the center of my hip, straight down through my femur, straight down through my tibia, and it's gonna come out of my second toe, which is the main load-bearing portion of the foot. When I can go here, now both of the stilts are under my body, so now my body is going to have less of a propensity to fall forward or rotate or do all these different things that it does because of how you've used your body over the years. So step number 1, every time I come to a stop, I'm at the grocery store, I'm at the bank, I'm at home, if I'm going to be standing there talking to someone for longer than 3 to 5 seconds, this is the technique. I stop, I take a quick look, because I need to look. When I look, I'm going to build more neural pathways quicker. That's going to teach it the new muscle and fascial memory of where it's supposed to go. So I'm going to come to a stop. If I'm here, I need to fix that. I need to come to more of this position. Now, I don't care what the size of your legs are. I have very big, bulky legs as well. So in the beginning, it's going to feel a little awkward. But again, if you want your body to be in less pain and more functional, a little bit of pressure on the inside of the legs is well worth not having a tremendous amount of back pain, neck pain, hip pain, knee pain. So again, if it's difficult, you can work on this chunks at a time. So if you come to here and that's painful, we're going to have you just come in a little bit. And you're going to practice that for 3 or 4 days. And then that's going to become comfortable, and then you're going to come in a little bit more. The number one thing that you can do to speed up this process is get the Relief Through Rolling program. The Relief Through Rolling program that I've created is a home care program that's going to be able to lengthen the cables the right way, put the tissue in the right position, so you actually be able to establish good posture, have a great line with less work. And if you can combine using the Relief Through Rolling method at home with this technique, it's going to speed up how quickly you're going to be able to get there and manage any kind of aches and pains while you have it. So step 1, you come to a stop, take a quick look, fix your feet. Step number 2. Again, we come to that pelvis. If that pelvis is tilted forward too much, that's going to spill everything forward, and that's going to be very difficult for my neck pain and my shoulder pain to go away, because now all of that's contracting, trying to bring me upright. So to help address the pelvis, what we're going to do is that almost all people have hyperextended knees in our culture. In America, just how we use our bodies, the number one pattern we see at the knees is that they're locked back, meaning they're hyperextended. And especially women who wear a lot of heels, you'll see that even more when they get out of their heels. The knees are really kicked back. And watch what happens to my pelvis. When I lock my knees back, you can see how much that spills that forward. So what we're going to do is, after we fix our feet, to make sure my knees are in the right spot, I'm going to lock them back, and then I'm going to relax them. If I'm not sure where they're supposed to be, I actually have to put them in that exaggerated hyperextension, and then I'm just going to relax the knees. Now, I don't want the knees bent. We're at this very fine point where just a little bit of pressure and they would go forward. Just a little bit of pressure and they would go backwards. So what I need to do is I'm going to come to a stop. I'm going to do step 1. Step number 2, if I'm not sure where the knees are, I'm going to lock them back, and then I'm just going to relax them. And you can see how that changes the position of my pelvis. And that's going to actually help me be more vertical, because when my knees kick back, it kicks me forward, and then I'm going to lean forward over my toes. Okay, so that's step number 2. Step number 3 is the most important part of this whole process. We are going to encourage you to get rid of suck the tummy in, bring the shoulders back, bring the chin in. We got to get rid of that. We're actually going to use a very simple technique called reciprocal inhibition at the neck to help establish and align your whole entire spine. Watch how this works. So once I put my feet more where they're supposed to be, make sure my knees are not locked back, all I'm going to do is I'm going to look up at the ceiling, and I'm going to bring my chin to level. And can you see how that just changed my whole rib cage? Now, if I let go of that, if I just let all that exaggerate forward into the typical computer position, we can see how all of that's rounded. So to address that and position it into a more efficient position, we also call it coming from the top of the head. But we don't want you to think about exaggerating and lifting yourself up. It's simple, it's relaxed, it's easy. All you're going to do is you're going to look up at the ceiling, you're going to bring your chin to level, and that's going to open up the rib cage. It's going to bring your shoulders in and back. It's going to have that head position, so it's all just stacked right on top of each other here, so you're not falling forward and compressed in all of the different things that people, all the different positions that people end up doing. So it's very, very, very simple. 3 steps. Feet are in the right spot, making sure my knees are not hyperextended. And the last piece, which is the most important piece, is I'm going to look up at the ceiling, I'm going to bring my chin to level, and that's going to help me have this nice lifted open posture without me forcing it. The beautiful part is that if you were to come up and touch any spot on my trunk through my hips, none of it is contracted harder than what it should be. It's all very relaxed, it's all very soft, because when I'm in my line, I'm actually using gravity to help me stay lifted in the field of gravity, instead of gravity pulling me forward, because you can either work with gravity or you can work against gravity. One more real simple trick to see where you're at is that once you've done all of this, if you still think you might be forward too much, what I want you to do is lift your toes off the ground. If you lift just your toes up and you feel like you're going to fall forward, it means you're using your toes too much. We should have equal amount of weight on our heel here and on our forefoot. There shouldn't be any weight on our toes. Just like if I'm doing a push-up, I don't want to put all of my body weight on my fingers. It's going to be distributed, and actually the majority of the weight is going to be on the palm here, because that's what aligns me in gravity. It's the same thing in my feet. If I'm too forward, my toes are working, and so if you just lift those toes up, let your body rest back to where you're not going to fall backwards, but you're in that perfect pivot point to where you can easily go any direction, but this is going to be nice, relaxed, established posture. A very simple technique. It's going to take a little bit of time, but if you're practicing it every day, and here's what I'll tell my patients. If you're uncomfortable, if you're feeling your neck, your shoulders, your back while you're standing or seated, while you're seated or standing, it means that you're not in your line with your head. So again, whether I'm in a chair and I'm at my workstation or I'm standing, it's that legs underneath. I'm going to look up at the ceiling, bring my chin to level, and that's going to help us establish a really functional line that is sustainable and easy to do. It's just going to take a little bit of practice. The two other things that you could do to speed up this process to make this happen so much quicker and easier is go to the Relief Through Rolling website, www.rtrolling.com, and purchase the Relief Through Rolling DVD. That's going to be for you. You can have that at home. You can use the foam roller, and it's going to be able to help you lengthen the cables that are too short. It's going to put the cables that are too long back to their correct position, and it's going to allow you to come here much easier, much quicker. The other number one thing that I suggest everybody to do is find a structural integration practitioner. They are going to be able to remodel your whole structure so all of the pieces and parts are contracting at the even length. This is our specialty. This is what Dr. Rolf spent 30 years perfecting before she started teaching people. This therapy in combination with the Relief Through Rolling, in combination with using this simple technique. In fact, if you don't buy the Relief Through Rolling DVD or find a structural integrator, just practicing this is going to be life-changing in itself. But if you add those other two components, the Relief Through Rolling program is going to be for you at home. It's kind of like having a fire extinguisher in your house. You don't want to have to wait on the fire department. You want to be able to handle a small little fire on your own. The Relief Through Rolling program is going to help change your life. And I encourage you to find a structural integrator. You can call our office. We can help find you one, 509-891-2368. Kevin Lucas with Structural Innovations and Relief Through Rolling, and thank you so much for spending this time with me. We'll talk to you real soon.